If you've noticed more hair falling out of your comb lately, especially after treating thyroid issues, you're not alone. Millions of people struggle with thyroid-related hair loss, a worrying sign that your body is out of balance. But the good news is your hair can grow back, healthier and stronger than before, when you give your body the right support. In today's episode of Vitality Daily Dose, we explore the top 5 supplements that can help prevent thyroid-related hair loss fast and effective. These nutrients not only improve the appearance of your hair, but also work deep into your cells to restore strength, bounce, and vitality. From collagen to rebuild structure, to iron and vitamin D to awaken dormant hair follicles, and silicon and biotin to promote healthy growth. Each supplement plays a key role in restoring your natural beauty from the inside out. And to boost the effectiveness even further, we'll also look at 2 powerful topical products, Rosemary Essential Oil and Minoxidil. Stay tuned, because by the end of this video, you'll know exactly how to restore your hair and your confidence. 1. Collagen, the foundation of hair follicle regeneration. Collagen is one of the most important proteins that helps maintain the structure and elasticity of the scalp. When the thyroid is underactive, the body reduces its natural collagen production, leaving hair weak and brittle. Supplementing with collagen helps nourish hair follicles from the roots, improve blood circulation in the scalp, and restore strength to the hair shaft. But choose easily absorbed collagen peptides and take them in the morning with vitamin C for optimal results. Collagen provides the essential components your body needs to produce more hair because it contains amino acids like proline and glycine. For best results, supplement with 12 to 20 grams of collagen peptides per day. Not all collagens are created equal, which is why I recommend using collagens that have been researched and proven to work, such as Veracol. You can find the collagen I recommend for thyroid patients and the one I personally use daily in the description of iron below. 2. Iron, the mineral that gives hair life. Iron deficiency is a common cause of hair loss in women with hypothyroidism. Iron helps carry oxygen to the hair follicles, vital for new hair growth. Your body needs iron to carry oxygen, and your body needs that oxygen to create energy. As you can imagine, hair growth is an energy-intensive process, and your body will sacrifice if it thinks other tissues or organs need more oxygen. In general, women often have a harder time maintaining iron levels due to their menstrual cycle. And this problem is made worse if you have thyroid disease, because the thyroid affects iron absorption in the intestines. Worse still, most doctors won't even detect iron deficiency until it causes systemic anemia. But there are many women, perhaps even you, who are listening to this right now, who have suboptimal iron levels, but are not found to be anemic. For these reasons, iron should be a top priority if you are a woman with thyroid disease, hair loss, or other hair problems. Iron delivers oxygen to hair follicles, which then use the oxygen to create energy for hair growth. You should only take iron supplements when absolutely necessary, as unnecessary iron supplementation can be toxic. Unfortunately, testing your serum iron levels is a poor way to assess whether you need iron supplements. Instead, you should test for a substance called ferritin, and if you find that your ferritin levels are not optimal, you should supplement with iron to bring them up to about 50 nanograms per milliliter. Ferritin is a measure of iron absorption, and you will see problems with your ferritin levels before you start to see problems with your serum iron levels. For thyroid patients, if you need to supplement iron, make sure you are taking a liquid form. And make sure you combine that liquid form with vitamin C to enhance absorption. 3. Silicon, the mineral that makes hair. Thick and shiny silicon plays an important role in strengthening the structure of hair strands, giving them more elasticity and shine. Research shows that silicon helps reduce breakage and speed up hair growth. You can find silicon in foods like oats and cucumbers, or in the supplement form of orthosilic acid, the most easily absorbed form for hair and skin. Technically, it is not considered essential, so it is not added to foods or other supplements like we do with other essential nutrients. And because silicon is really only found in significant amounts in plant-based foods, many people do not get enough of what they need through diet alone. But that is better for you, because it means it is an easy opportunity to reap the big hair benefits. Silicon is mainly concentrated in hair, skin, and nails. And when you supplement it, you will increase the elasticity and function of your hair. There is no official consensus on how much each individual should take. But I find that 20 to 40 milligrams of silicon per day is ideal for thyroid patients. To avoid absorption problems when using silicon, make sure you use a highly bioavailable source, such as MMST, which stands for monomethylene test. Using standard silicon will lead to polymerization and poor absorption. 4. Biotin vitamin for hair vitality. Biotin, also known as vitamin B7, is one of the familiar heroes in anti-hair loss products. Biotin supports energy metabolism and keratin synthesis, the main component of hair. For people with thyroid disorders, the ability to absorb biotin is often reduced. So regular supplementation can make a noticeable difference. Choose products that contain biotin combined with zinc and selenium for increased nutritional effectiveness. Biotin is absolutely essential for hair growth, but if you take it alone, you may not get the results you want. Instead, the key to using it successfully is to combine it with other nutrients like the ones we discussed above. This allows biotin to do its job, which is to create more energy within the hair follicles so your hair can grow, while the other ingredients support the quality of your hair. Biotin promotes the production of keratin, which, remember, is the building block of your hair, by increasing the amount of energy your hair follicles can produce. Since biotin is a water-soluble B vitamin, you can get a lot of it, and you probably will need a lot if you want to grow long hair. Typical doses range from 5,000 to 10,000 micrograms per day. Thyroid patients often see better results with higher doses, but you must remember that biotin can affect the accuracy of thyroid tests. That doesn't mean you should avoid it. And you can solve this problem by avoiding any supplements containing biotin for about 3 days before you plan to have your vitamin D test. 5. Vitamin D activates sleeping hair follicles. Vitamin D deficiency not only affects the immune system, but also directly causes thinning and slow hair growth. Vitamin D activates sleeping hair follicles to return to a new growth cycle. Sunbathing in the morning for 15 minutes a day or taking liquid. Vitamin D3 supplements is a natural and effective way to restore vitality to hair. Vitamin D supports a healthy hair cycle, which is the leading cause of hair loss in thyroid patients. Dosage will vary from person to person, depending on absorption and body fat levels, but a safe daily dose is usually between 2,000 and 2,500 IU. However, it should be noted that some people reading this will need doses as high as 10,000 IU per day. If you have thyroid disease and want to supplement vitamin D, I recommend taking liquid vitamin D and making sure to also supplement vitamin A and vitamin K too. In addition to supplements, rosemary essential oil and minoxidil are 2 options that have been shown in numerous studies to significantly stimulate hair growth. Rosemary oil acts as a natural stimulant, increasing blood flow and helping hair follicles repair. So far, we have talked about supplements that work from the inside out, but this is a supplement that works from the outside in. By applying rosemary to your scalp, you will stimulate better blood flow and circulation, bringing the necessary nutrients to the hair follicles to support hair growth. It's considered to be slightly less effective than the over-the-counter medication minoxidil, but it has a better safety profile. Rosemary oil promotes more hair growth by increasing oxygenation and circulation to your scalp. You can find rosemary oil in topical essential oil solutions that can be applied directly to your scalp. You can apply it to your scalp and then rub it in with a silicone massager, or you can just put it in your conditioner or shampoo and then apply it that way. Minoxidil, when used properly, helps prolong the growth phase and increase hair density in just a few months. Although it is technically considered a pharmaceutical, it is still available over the counter, which is why I included it here. It actually works quite similarly to rosemary oil, which we just discussed. So if you prefer a more natural approach, go for rosemary oil. And if you prefer a pharmaceutical approach, go for minoxidil. The biggest benefit of minoxidil is that it has been well researched and has even been approved by the FDA for use in some hair loss conditions. It works by prolonging the amount of time your hair spends in the growth phase. As a result, you will lose less hair and have a longer hair growth cycle. And again, this is helpful for people with thyroid disease, who often have many hair follicles that are in the dormant phase for too long. Minoxidil is typically targeted at men, but it works well in women too, and it does this by supporting and regulating a normal, healthy hair cycle. All you need to do is buy minoxidil over the counter and use it as directed. It is available in a 2% or 5% solution as a foam or liquid. By combining internal care with supplements and external treatment with essential oils or minoxidil, you can completely reverse thyroid hair loss and get your hair back to its healthy, beautiful state. If you are struggling with thyroid hair loss, remember it is not the end of your hair. When your body is properly nourished, your hair follicles can completely recover and grow again. Start by providing your hair with essential nutrients like collagen, iron, silicon, biotin, and vitamin D. These nutrients not only help improve hair thickness and vitality, but also support hormone balance and boost metabolism, which is extremely important for people with thyroid disease. Don't forget to combine rosemary essential oil and minoxidil to stimulate hair growth faster from the outside. When you are persistent, the results will surprise you. Healthy, thick, and vibrant hair again, reflecting the restored balance inside your body. If you found this article helpful, don't forget to leave a comment, like, share, and subscribe to the channel so you don't miss out on more in-depth instructions from Dr. Westin Childs. Your hair deserves to be revived. Start today.